SARS-2 is a contagious disease caused by coronavirus SARS-CoV. In January 2020, it spread worldwide, resulting in the COVID-19 pandemic. How does it spread? It spreads mainly through person to person. First, respiratory droplets and aerosols. Second, surface contact, but it is less common. Third, close physical contact. Now, symptoms of coronavirus. It usually appears 2 to 14 days exposure to the virus. Fever or chills, sore throat, cough, fatigue, shortness of breath or difficulty breathing, muscles or body ache, sore, headache, congestion or runny nose, nausea or vomiting, diarrhea. Risk factor for severe COVID-19. Its affect age. Older adults are at higher risk, especially over 65-year-olds. Pre-existing health condition. Example: heart disease, chronic lung disease, diabetes, weakened immune system, pregnancy, smoking and substance use. Diagnosis of COVID-19. COVID-19 is typically diagnosed through a combination of symptoms, medical history and laboratory tests. Key steps in diagnosis. Symptoms assessment. Healthcare provides often begin by asking about symptoms, risk factors and exposure history, medical history and risk factor. Physical examination. Types and tests of COVID-19. First, PCR, polymerase chain reaction test. Gold standard for COVID-19 reaction. Rapid antigen test. Detect protein on the surface of the virus, not the virus genetic material. Antibody serology test. Detect antibodies that the body produces after being infected with COVID-19. Treatment. First, we will talk about home treatment about COVID-19. Home treatment is rest and hydration, manage fever and pain, treat cough and sore throat. Now let's talk about hospital treatment for COVID-19. Initial assessment and monitoring. Vital sign monitoring means oxygen level, heart rate, blood pressure and temperature to monitor overall health and identify any complication early. Oxygen therapy. Oxygen supplementation is often the first line of treatment for severe COVID-19. Medication and antiviral treatment. Antiviral drugs may be prescribed to reduce the severity and duration of the infection. Now, what are the medications used in COVID-19? First, antiviral medication. Paxlovid class antiviral, Levio class antiviral. The purpose is disrupts the virus ability to replicate by causing errors in its RNA. Monoclonal antibiotics. Steroids is the prevention and vaccination, wearing mask, social distancing, hand hygiene, avoid touching your face, cleaning and disinfecting surfaces, testing, quarantine and isolation. Thank you.